What if I told you that the secret to looking and feeling younger might start with your hair? It's not just about aesthetics. Your hair is an incredible barometer of what's happening inside your body. Today, we're going to explore how the signs of aging you see in your hair are intimately connected to your overall longevity, and more excitingly, how you can fight hair aging and keep your hair looking youthful for longer. Welcome to the Longevity Show. I'm Dr. Hillary Lynn, and today we're diving deep into how hair health can be a window into your overall vitality. We'll uncover why your hair thins, why it grays, and most importantly, how you can reverse those changes. This isn't about surface fixes or expensive products. It's about getting to the root cause, literally and biologically. Hair health is a powerful indicator of the health of your entire system, and by rejuvenating your hair from the inside out, you can also unlock better health across the board. That's why it's such an important topic for longevity. I've seen firsthand how addressing hair issues can reveal much larger health opportunities. One of my many patients, Michelle, came into me recently over sudden thinning in her late 30s. It turned out her hair was the canary in the coal mine. It alerted us to some underlying hormonal balances. She was experiencing perimenopause and certain nutritional deficiencies that we needed to address. Once we tackled those, not only did her hair bounce back, but her energy, mood, and sense of vitality did too. So let's get into it. What is your hair telling you about your health, and how can you use that knowledge to turn back the clock, not just for your hair, but for your entire body? If you've ever wondered why some people keep full, lush hair well into old age, while others start to thin or gray seemingly overnight, you're not alone. The answer lies beneath the surface, in the biology of your hair. Each strand follows its own growth cycle: anagen, catagen, telogen, and exogen. These phases determine your hair's fate and are influenced by everything from your genes to your hormones, nutrition, and even stress. Let's start by understanding what's actually happening in these cycles and how they hold the key to youthful, thriving hair. Every strand of hair follows its own timeline. Picture a field of flowers where each bloom is on its own schedule, some sprouting, others wilting, and a few resting before bursting into bloom again. Your hair works very much the same way, undergoing those four key phases: anagen, catagen, telogen, and exogen. The anagen phase is the active growth period of your hair. It lasts for 2 to 6 years. About 85% of your hair is in this phase at any given time. During anagen, the hair follicle is constantly dividing to produce the hair shaft, supported by a rich blood supply, providing essential nutrients and oxygen. The longer a follicle stays in anagen, the longer your hair can grow, which is why some people can grow their hair very long, while others struggle to get past a certain length. The catagen phase is a short intermission. It lasts only 2 weeks. During catagen, the follicle undergoes this controlled regression, allowing it to reset and prepare for the next growth cycle. Next comes the telogen phase, which lasts 1 to 4 months. During this phase, the follicle is inactive, with around 9% of hair follicles in this phase at any given time. The hair is no longer growing, but remains attached until it's ready to shed. Then we have the exogen phase. This is where the old hair shaft is finally shed, making room for new growth. Shedding is a natural and necessary part of the cycle, like old leaves falling off a tree so new ones can grow. These phases are influenced by more than just genetics. Hormones, stress, nutrition, and local signals also play a role. Disruptions, whether due to these factors like stress or hormonal imbalances, can lead to your hair falling out prematurely or taking longer to regrow, causing noticeable thinning. Now let's tackle one of the most iconic signs of aging: gray hair. The color of your hair is determined by melanocytes, cells that produce pigment. Think of melanocytes as tiny artists painting each strand. Over time, these artists run out of paint due to oxidative stress, genetic factors, and environmental triggers that cause them to produce less pigment, leading to gray or white hair. Oxidative stress plays a big role here. It's like rust forming on metal. Your cells experience damage from free radicals, unstable molecules resulting from pollution, UV exposure, and even normal metabolic processes. When oxidative stress overwhelms the body's defenses, melanocytes suffer, leading to graying. To wrap up what we've covered so far, we have our hair growth phases. Your hair goes through the 4 phases: growth, anagen, transition, catagen, resting, telogen, and shedding, exogen. Healthy hair relies on balanced cycles supported by nutrients, hormonal balance, and proper care. Factors like stress, nutritional deficiencies, or hormonal changes can disrupt these phases, leading to noticeable hair thinning or slow regrowth. And the loss of pigment in your hair, graying, happens when melanocytes, the cells responsible for color, lose their ability to produce pigment, often accelerated by oxidative stress. So understanding these basics provides the foundation to improve and maintain healthy hair. Let's now move on to the factors that influence your hair's health, from genetics to lifestyle choices, and what you can do to maximize those luscious locks. As we continue our journey into understanding our hair, it's natural to ask, why doesn't our hair look like it used to? Maybe it's thinning, losing its color, or it's just different in texture. And the answer, as we started talking about, is in the biology, the complex interplay of genetic, cellular, aging, and environmental influences that determine how our hair changes over time. So now we'll explore the forces at play, from DNA damage to hormonal shifts, and how they shape the way our hair evolves over the years. So let's start with two significant factors many of us are familiar with: hormones and oxidative stress. First, hormones have a major impact on our hair health, particularly as we age. Dihydrotestosterone, DHT, which is a byproduct of testosterone, is notorious to contributing to hair thinning, particularly in men. DHT binds to receptors in hair follicles on your scalp and gradually shrinks them. This is a process called follicular miniaturization. Over time, these shrunken follicles produce weaker, shorter hairs until they stop altogether. For women, hormonal changes during menopause or perimenopause lead to reduced estrogen, which typically protects hair follicles. The resulting hormonal imbalance, combined with increased androgens, often leads to thinning hair and changes in texture. Oxidative stress is another major player in hair aging. It's like rust forming inside your body, driven by unstable molecules called free radicals, which cause cellular damage. Melanocytes, those are the cells that give hair its color, are particularly susceptible to oxidative stress, which reduces pigment production, leading to that graying effect. UV radiation, pollution, and even normal metabolic processes all contribute to oxidative stress. Fortunately, antioxidants that are found in certain foods like berries, green tea, and dark chocolate can help neutralize these free radicals and potentially slow down the graying process. Now that we've explored the hormonal and environmental factors contributing to hair aging, let's look deeper at the cellular mechanisms behind these changes. So imagine each hair follicle as a tiny factory producing new cells to keep hair growing. As we age, these factories start to experience wear and tear, much like old machinery. Cellular aging is driven by DNA damage, mitochondrial dysfunction, and declining hair follicle stem cells, HFSCs. Hair follicle stem cells, these HFSCs, are the lifeblood of hair regeneration. Over time, these hair follicle stem cells lose their ability to function well, leading to follicular miniaturization and eventually hair loss. Type 17 collagen, which is also known as COL17A1, plays a key role in maintaining HFSC resilience, but DNA damage causes COL17A1 to break down. So that reduces stem cell vitality, similar to a factory losing key workers, slowing down production. Mitochondria, the cell's powerhouses, are also crucial for hair growth. They fuel the energy needs of hair follicle cells, particularly during the growth phase. As we age, mitochondria become less efficient, making it harder for hair follicles to generate energy. Mitochondrial dysfunction increases reactive oxygen species, ROS, causing oxidative stress that damages both those hair follicle stem cells and melanocytes. Research into emerging therapies like mitochondrial transplantation offers hopes for restoring hair growth and reducing damage markers. Beyond mitochondria and stem cells, another key player in cellular aging is telomeres, the protective caps at the ends of DNA strands. Telomeres are like the plastic tips on shoelaces, protecting the chromosomes that are DNA from fraying. Each time a cell divides, telomeres shorten, and once they get too short, the cells lose their function. In hair follicle cells, shortened telomeres mean a shorter growth phase and increased shedding. Interestingly, the enzyme telomerase maintains telomere length and also plays a role in reactivating stem cells in hair follicles. So it's really important for hair rejuvenation. Studies in mice have shown that stimulating telomerase can help restore such hair growth. Hair follicles rely on a reservoir of stem cells to regenerate new hair, but over time, this reservoir runs dry. Stem cell exhaustion not only leads to thinning hair, but also decreases the ability of follicles to recover after shedding. Maintaining a healthy environment for these stem cells through nutrition, stress management, and potentially future therapies could be key to healthy hair growth as we age. The changes that occur aren't limited to the physical structures within the cells. Internal communication systems, called signaling pathways, also shift with age. As hair follicle stem cells age, the signaling pathways guiding them begin to change. In young cells, the WNT signaling pathway promotes hair regeneration. With age, hair follicle stem cells shift from regenerative WNT signaling to non-regenerative WNT5A signaling, which is a different pathway that inhibits hair growth. Elevated levels of WNT5A and CDC42 impair the hair follicle stem cell function, essentially rewriting the cell's blueprint to slow or halt hair growth. Studies in mice suggest that inhibiting CDC42 can actually restore normal signaling and promote hair regeneration, offering hope for future therapies. Understanding the biology of hair aging really provides this insight into how we can fight back. By reducing oxidative stress, supporting mitochondrial health, balancing hormones, and potentially targeting signaling pathways, we can make a difference in how our hair ages. While aging might be inevitable, we're not entirely powerless. Now we'll explore the exciting part: what we can do to reverse hair aging, prevent graying, and promote hair growth. From everyday habits to emerging therapies, there are plenty of options to help keep your hair as healthy and vibrant as possible. Continuing our deep dive into the science of hair health, let's now focus on something we all have control over: nutrition. It's fascinating how foods we eat can profoundly impact the vitality of our hair. Now we're going to explore how nourishing ourselves from the inside out can support our hair growth, prevent hair loss, and even reduce graying. Vitamin D, the sunshine vitamin, might surprise you with its role in hair health. Vitamin D isn't just essential for bone health, it also plays a key role in the hair growth cycle. So studies have shown that it can promote hair growth by inhibiting inflammatory pathways that might otherwise disrupt the hair cycle. To boost your vitamin D, spend some time outdoors each day. Include fatty fish like salmon and mackerel in your diet, as well as fortified dairy and egg yolks. And if needed, consider a supplement, but always consult your doctor before adding any new supplement to your routine. As a bonus, I always recommend taking vitamin D3, which is the form that your body can use readily. If you take other forms of vitamin D, it takes a little bit extra time, so it's not quite as optimal as a supplement. In addition, you'll want to add vitamin K2, which can support bringing calcium that's produced into your bones, rather than leaving it in your bloodstream and potentially causing calcification of your arteries. Finally, magnesium is really important as well. We forget about it a lot, but without proper levels of magnesium, your body can't take advantage of the vitamin D that you're supplementing. Another crucial player in hair health is the vitamin B complex, particularly biotin, often hailed as the hair growth vitamin. Biotin, or vitamin B7, is essential for keratin production, the main structural component of your hair. Even mild biotin deficiencies can lead to thinning or brittle hair. So make sure to include biotin-rich foods in your diet, like eggs, almonds, sweet potatoes, spinach, and broccoli. Whole grains and legumes are also great sources of various vitamin B vitamins. And if you need, you can take biotin supplements, but remember, more isn't always better. Excessive intake does not necessarily lead to better hair growth. And something interesting about biotin is that it affects many lab tests. So if you're thinking in the next week that you're going to go in and get your blood tests for your annual visit, or perhaps for your longevity test, make sure that you pause your biotin supplements at least 3 days before the test, maybe even up to a week, because it can certainly alter a lot of the tests significantly enough to confuse you and your doctors. Iron is another key player, essentially acting as the oxygen carrier for your hair follicles. Iron deficiency is one of the most common causes of hair loss, particularly in women, because prior to menopause, we're menstruating. So iron helps red blood cells carry oxygen to all the cells in your body, including those that stimulate hair growth. To maintain optimal iron levels, eat lean meats, poultry, fish, lentils, beans, and leafy greens like spinach. Pairing iron-rich foods with sources of vitamin C, like citrus fruits or bell peppers, can improve absorption. If you're concerned about iron deficiency, it's a good idea to get your levels checked before starting any supplementation. And if you're going to supplement, I recommend to my patients to take the more bioavailable form of iron, which is ferrous bisglycinate. And you can take it every other day. I prefer that because if you take it every day, it can impact certain other effects, not related to the hair. But for example, I have patients who have restless leg syndrome, and we recommend making sure that your iron levels are adequate for them. But also, if you're taking it for that reason, you don't want to take it every day because it decreases the effectiveness and sensitivity of your body to the positive benefits. And if you are taking iron and you want it to be better bioabsorbed, Often supplements will include vitamin C in it, but again, you can take in more vitamin C at the same time, or you can supplement it. Zinc plays a vital role in supporting hair tissue growth and repair. It's involved in DNA and RNA production, which is essential for cell division in hair follicles. To boost your zinc intake, include foods like oysters, beef, chicken, pumpkin seeds, lentils, and chickpeas. However, keep in mind that balance is key. Too much zinc can actually interfere with other important minerals, such as copper. This is actually why I don't typically recommend to my patients to take zinc supplements. It's really, really easy to overdo it with zinc supplementation. So I prefer getting zinc from whole foods. Essential fatty acids, omega-3 and omega-6, are also vital for hair health. So these fatty acids nourish the hair, support thickness, and help reduce inflammation that can contribute to hair loss. Omega-3 sources include fatty fish, like salmon, as well as flax seeds and chia seeds and walnuts. However, if you're taking it from plant sources, you're going to want to take a lot more because your body can only utilize a small portion of plant-based omega-3s. Omega-6 can be found in foods like sunflower seeds and corn oil. I know there's a lot of debate right now about seed oils and inflammation, but as far as the research shows, omega-6s are also helpful for hair growth. If you're not getting enough omegas from food alone, fish oil supplements can be a really great option. Studies have shown that omega-3 and omega-6 supplements, along with antioxidants, can significantly reduce hair loss and increase hair density. Speaking of antioxidants, these nutrients act as the body's defense system against oxidative stress. Oxidative stress can damage your hair follicles directly, leading to hair loss. So to increase your antioxidants in your diet, the food rich in antioxidants are berries, dark chocolate, so that's 70% cocoa or more, green tea, spinach, and kale. And these can help neutralize free radicals and protect your hair. Some studies have even shown that applying antioxidants directly to the scalp can help improve scalp conditions and reduce hair shedding. Now let's talk about some nutraceuticals that are gaining attention in the world of hair health, like Viviscal, Nutrafol, and Pantagar. I know I see ads all the time for these types of supplements, and I'm sure you have too. So Viviscal contains a marine protein complex called aminomar C, along with vitamins and minerals. And there are studies showing that it can increase hair volume and reduce shedding after consistent use. Quick note, studies done on commercialized products like supplements are always slightly suspect because they're biased. They're typically funded by the companies that are selling the supplement. That being said, if the studies are well done, and especially if they're repeatable in different labs, I do put a little bit of credence in them. They're not total garbage. You just have to take a close look at the studies, make sure that there's actually a clinically significant effect. So Nutrafol uses botanicals like saw palmetto and ashwagandha, plus vitamins and minerals to target multiple underlying causes of hair thinning, including stress and hormonal imbalances. So stress is treated by the ashwagandha, and the saw palmetto actually treats some hormonal imbalances. Pantagar, which comes from Germany, contains a mix of amino acids, keratin, and B vitamins, and has been reported to improve hair thickness and reduce shedding as well. And as always, talk to your doctor before you're adding any of these supplements to your routine. Collagen, does it work? We used to say that collagen was nonsense, but the science is coming around, and now doctors are starting to accept that collagen as a supplement can be really helpful for skin and hair health. It's a bit easier for your body to absorb than the entire protein, so it does make sense to occasionally supplement with it. Collagen is another powerhouse when it comes to supporting hair health. So collagen peptides, particularly those derived from fish, so marine sources of collagen, have been shown to promote hair growth by supporting the body's own hair building proteins. Fish-derived collagen peptides can enhance hair regrowth by affecting key signaling pathways that help with the hair follicle development. Collagen supplements can also support not just your hair, but your skin and your nails. Foods like bone broth, which I love, and gelatin are traditional sources of collagen, and a recent trial actually showed that a supplement containing hydrolyzed fish collagen, amino acids, iron, and selenium significantly improved hair growth. Finally, let's touch on some plant-derived compounds and oils that can benefit hair health. Foods rich in flavonoids like berries, onions, and kale have antioxidant properties that protect hair follicles. Pumpkin seed oil, which is rich in antioxidants and essential fatty acids, has been associated with improved hair growth. So in one study, men taking pumpkin seed oil saw a 40% increase in hair count after 24 weeks. So it took a while. A lot of nutritional interventions do take a while. Tocotrienols, which is a form of vitamin E found in palm oil, rice bran oil, and certain grains, have also been linked to increased hair growth. Again, I know there's a lot of debate about seed oils, palm oil, and so forth, but I'm just stating the studies here which do support hair growth when you take any of these types of oils. How can you put all of this into practice? Here's a quick and easy action plan that you can enact this week. Start eating a balanced diet rich in the vitamins and minerals we've discussed today. Consider targeted supplements if you have specific deficiencies or dietary restrictions, particularly if you're vegan. It could be a little bit harder to get the adequate nutrients. So supplements like Viviscal, Nutrafol, or collagen peptides might be beneficial. Increase your antioxidant intake by adding more berries, leafy greens, and green tea into your diet. Stay hydrated because water is essential for nutrient absorption and overall health, including for your hair. Monitor your progress over months, not simply days or weeks. Hair growth takes a lot of time, so be patient and consistent. Fun fact, I just noticed that I've had a slew of new hair growth, so I'm seeing really interesting baby hairs come out. I've got hair of all different lengths, and this came after a period of shedding, so I found that really interesting. If you're like me and maybe something happened, perhaps you were pregnant, or maybe there were severe weather changes that can also cause hair shedding, then you'll notice baby hairs coming out, and they'll be at different lengths, but you can notice them as the tiny little short hairs that stick up. By nourishing your body with the right nutrients, you're going to give your hair follicles the tools they need to thrive. It's empowering to know that even small changes in your diet can significantly impact your hair's vitality. But nutrition is just one piece of the puzzle. Now let's explore the role of hormones in maintaining youthful hair. If nutrients are the building blocks of hair growth, hormones are the architects. They regulate and design the entire process. Let's explore how hormonal balance affects hair growth, hair loss, and what we can do to keep our hair youthful. When it comes to hair health, one hormone stands out: dihydrotestosterone, or DHT. DHT is a potent androgen. That means it's a male sex hormone, and it's derived from testosterone by the enzyme 5-alpha reductase. While DHT plays an important role in the body, it can also negatively impact hair follicles, particularly for those genetically predisposed to hair loss. DHT binds to androgen receptors in hair follicles, particularly in dermal papilla cells, which are crucial for regulating hair growth. This binding triggers several changes that lead to hair loss. First, hair follicle miniaturization. DHT causes hair follicles to shrink over time, leading to thinner, shorter, and more fragile hairs. Secondly, we have cell cycle arrest. DHT reduces the ability of dermal papilla cells to multiply, shortening the hair's growth phase, that anagen phase, meaning hair grows more slowly and falls out sooner. Then we have inhibition of the growth pathways. So DHT downregulates that WNT beta-catenin pathway, which is essential for hair follicle growth, effectively slowing down the natural growth engine of your hair. Then we have the activation of the hair loss pathways. So DHT activates the TGF-beta SMAD pathway, which accelerates the shrinking of hair follicles, promoting hair loss. So you might have noticed that some areas of the scalp are more affected than others. You can see this especially on men, but in some women, if you pull back the temples, you can also notice that hair loss can happen more along the sides at your temples. So hair loss often starts at the temples or the crown because these areas have more androgen receptors, making them more sensitive to DHT. In contrast, the back of the head has fewer receptors, which is why hair there often remains fuller and is commonly used for hair transplants if needed. Understanding the role of DHT has led to the development of specific treatments that combat hair loss. First, we have 5-alpha reductase inhibitors. So these medications reduce the conversion of testosterone to DHT, lowering DHT levels in the scalp. Finasteride is approved for male pattern hair loss. It can reduce DHT by about 60%, helping to slow hair loss and promote regrowth. Dutasteride is not technically FDA approved for hair loss, but it's often used off-label. It's the exact same mechanism, but more potent than finasteride. It reduces DHT levels by over 90%, and we commonly believe it to be more effective than finasteride. An important note is that these medications are typically prescribed for men. Women of childbearing age should avoid them due to the risk of birth defects. But for women, on the other hand, we have some medications we can use because we don't need quite as much testosterone. Androgen receptor antagonists can block the effects of DHT on hair follicles. Spironolactone blocks androgen receptors, reducing hair shedding and promoting regrowth. There's also cyproterenine acetate, which is used in combination with estrogen in contraceptives to reduce testosterone and lessen its impact on hair. So for all of these medications medications, there are potential side effects and considerations that might be pretty major for you. For finasteride and dutasteride, there are possible side effects that include decreased libido, erectile dysfunction, and in rare cases, depression. So this hasn't happened very much in my patient population, if at all, but I want to put it out there because there are reports of this happening, like finasteride syndrome, some people call it. And for women who are taking spironolactone, some of the possible side effects can include dizziness, fatigue, and menstrual irregularities. So regular checkups are advised. And more, we're starting to realize the benefits of testosterone for both men and women. So that's why I'm a little reluctant, unless the hair loss is quite severe, to put someone on spironolactone. It's something to talk about with your doctor and not to just jump to right away. For those who are looking for natural alternatives, certain substances may help reduce DHT levels. Saw palmetto, like we spoke about, is an herb that can inhibit that 5-alpha reductase, potentially lowering DHT. Some studies are promising, but there isn't as much research support as with the prescription medications we spoke of. Pumpkin seed oil is rich in phytosterols and may also inhibit DHT and has shown some promise with supporting hair growth. So that's another option. And beyond medications and supplements, lifestyle factors can significantly influence hormonal balance. As we mentioned, nutrition is super important. Get that adequate B vitamin complex, zinc, and vitamin D to support your hormonal balance and support healthy hair growth. Stress management is also so important. Chronic stress disrupts hormonal balance and contributes to hair loss. Techniques like meditation, yoga, and deep breathing exercises can help manage stress levels. Physical activity helps regulate hormones and improves blood flow to the scalp, supporting overall hair health as well. If you're dealing with hormonal hair issues, talk to your doctor first of all and get personalized advice, and perhaps get testing of your hormone levels to better understand any underlying imbalances. Consider those supplements or medications if appropriate as well. And most of all, make sure that you have a nutrient-rich diet, have proper stress management techniques, and regularly exercise to support your hormonal balance. Everyone's situation is unique, so the key is finding what works best for you. Now that we've covered nutrition and hormonal influences on hair health, let's dive into the world of cellular energy and how it plays a critical role in maintaining and improving hair growth. Hair follicles are among the most metabolically active structures in the body, meaning they require significant cellular energy to maintain healthy growth cycles. Now we're going to talk about different interventions that focus on cellular energy to support vibrant, youthful hair. First, one of our most promising interventions for cellular energy and hair health is low-level light therapy, or LLLT. This is also known as photobiomodulation or red light therapy. Red light therapy works by delivering targeted red light to the scalp, enhancing mitochondrial function, cell proliferation, and collagen synthesis in fibroblasts. These are cells that are crucial for hair growth. The mitochondria, the powerhouses of the cell, produce ATP, which is our cell's energy source and essential for hair follicle vitality. Research has shown that red light therapy can be particularly effective when combined with active substances like arginine, articular extract, and biotin tripeptide 1, which all work synergistically to reduce inflammatory cytokines and increase pro-hair growth factors, such as VEGF, which is vascular endothelial growth factor, and beta-catenin. These pro-growth factors support the growth cycle of hair follicles, helping to rejuvenate thinning hair and improve density over time. Nutritional supplements also play a significant role in supporting cellular energy for hair health. High-quality evidence supports the use of nutraceuticals like Viviscal, Nutrafol, and the omega-3s and 6s that we mentioned, as well as antioxidants. So these supplements will provide essential nutrients, but also support mitochondrial function, which is, again, crucial for our hair health. In particular, Anarcha apple polyphenols have been shown in studies to promote keratin production in hair follicles. These work by inhibiting the pentose phosphate pathway and the amino acid oxidation, both of which are implicated in the aging of hair follicles. By boosting keratin production, Anarcha apple polyphenols help to strengthen hair and improve overall thickness and shine. Another fascinating area of cellular interventions for hair health involves regenerative cellular therapies, including the use of mesenchymal stem cells, or MSCs. So mesenchymal stem cells, particularly those derived from our adipose tissue, that's our fat, have shown potential potential in promoting hair growth through their paracrine effects. That's where the cells secrete signaling molecules to neighboring cells to promote regeneration. Dermal papilla cells, DPCs, and dermal sheath cup cells, DSCs, are also being explored for their role in inducing new hair follicles and modulating immune responses. So these cells are believed to contribute to the rejuvenation of hair follicles by enhancing mitochondrial function and cellular regeneration, making them promising candidates for future hair restoration therapies. Beta-nicotinamide mononucleotide, or NMN, is another intervention showing potential for hair health by enhancing cellular energy production. You've probably heard of these in the family of NAD plus precursors. So NMM helps promote hair growth by reducing oxidative stress and inflammatory mediators in the dermal papilla cells. It also enhances the expression of pro-hair growth factors like VEGF and beta-catenin while suppressing androgen receptor and DKK1 expression, both of which can negatively impact hair follicle health. NMN offers a promising avenue for targeting the cellular mechanisms involved in hair thinning and loss. Now we've got an interesting one that many people have heard of. Platelet-rich plasma, or PRP therapy, is an emerging treatment for hair loss, particularly for the male pattern balding or androgenetic alopecia. PRP is derived from the patient's own blood, processed to concentrate platelets and growth factors like PDGF, which is platelet-derived growth factor, EGF, epidermal growth factor, and VEGF. These growth factors are believed to promote hair follicle health and stimulate hair growth. Clinical studies have shown that PRP can significantly improve hair density and thickness, with results often visible after just a few sessions. The efficacy of PRP can vary dependent on the preparation method, but is generally considered a safe therapeutic option with promising outcomes. So when combined with other growth factors such as basic fibroblast growth factor, BFGF, PRP has demonstrated enhanced efficacy in promoting hair growth. While cellular interventions focus on restoring hair health and growth from within, hair transplantation remains an effective cosmetic solution for those seeking immediate results. So hair transplantation involves relocating hair follicles from the back of the head, where DHT sensitivity is lower, to areas of thinning like the crown or the temples. Though purely cosmetic, this is an important option for those who want to complement other hair growth interventions. And significantly, a lot of people who have suffered from hair loss for a long period of time no longer have any follicles left in those bald areas. And so those people need to get hair transplantation in order to have the hair grow again in those balding spots. When there's no more hair follicles, there's no chance of rejuvenation. So if you're noticing hair loss, it's really important to act early if you want to go in from inside out, like we're talking about in today's episode. Interventions that target cellular energy offer such exciting opportunities to improve our hair health from within. So by leveraging technologies like red light therapy, regenerative cellular therapies, and PRP, along with cellular boosters like NMN, we can address the multifactorial nature of hair loss comprehensively. Each of these treatments works to enhance cellular energy, stimulate growth factors, and rejuvenate hair follicles, contributing to thicker, healthier hair. So thank you for joining me on this comprehensive journey to understand and optimize your hair health. We covered a lot of ground today, from the fundamental biology of hair growth, aging, and the reasons behind hair thinning and graying, to the powerful interventions available to keep your hair thriving. So let's recap some of the key takeaways from today's episode. First, understanding hair growth and aging. We explored how your hair grows through distinct phases: anagen, growth; catagen, transition; telogen, resting; and exogen, shedding. Healthy hair depends on a well-balanced cycle, supported by proper nutrition, stress management, and hormonal balance. We also learned that graying and thinning are natural parts of aging, often driven by oxidative stress, genetic predispositions, and hormonal shifts. So the same interventions that you're going to use to counter hair loss are exactly the same that you're going to use to counter hair thinning and graying. Remember, the melanocytes, or the little cells that are painting the color on each hair, they are the most sensitive to oxidative stress. Nutrition is key. So we discussed how proper nutrition can significantly influence the health of your hair. Key nutrients like vitamin D, biotin, iron, zinc, omega fatty acids, antioxidants, and collagen all play critical roles in promoting hair growth, preventing thinning, and maintaining vibrant, strong hair. 3, we have to have hormonal balance. Hormones act as the architects of hair growth. we learned about DHT, a major player in hair loss, and how hormonal imbalances can accelerate hair thinning. Medical interventions like 5-alpha reductase inhibitors, finasteride and dutasteride, and androgen receptor blockers, spironolactone, and natural supplements such as saw palmetto and pumpkin seed oil can help manage these hormonal influences. It's also extra important to maintain a healthy, nutritious diet and to exercise to stabilize your hormones. Finally, we dove into the world of cellular energy and innovative treatments. Interventions like low-level light therapy, red light therapy, nutraceuticals, regenerative cellular therapies such as mesenchymal stem cells, beta-nicotinamide mononucleotide, or NMN, and platelet-rich plasma, PRP, therapy all target hair health at the cellular level, rejuvenating hair follicles and boosting growth. These approaches, while varied, all share a common goal: to maintain healthy, vibrant hair by addressing the root causes of hair aging and loss rather than simply masking the symptoms. So if you found today's episode helpful, I would love for you to stay connected with me for more tips and insights on health, wellness, and longevity. Follow me on social media at Hillary Lynn MD. Together, we can continue exploring the latest ways to optimize our health and well-being, from hair health to full body vitality. So remember, your hair is not just a reflection of your age or genetics. It's a window into your overall health. By taking a holistic approach that includes balanced nutrition, hormonal management, cellular support, and targeted interventions, you can take control of your hair's future and help it reflect your best self. Thank you again for listening, and I look forward to seeing you in our next episode. Stay tuned and stay healthy.